Hey YouTube, what's up? This is Miss Anxious 305 coming at you today. It's December the 5th, 2011. It is 11. Ooh, sorry, stomach cramp. 11:21 p.m. Sorry I'm late making this update, but it was a lot going on. I got here at 7 o'clock a.m. this morning. I did not go into surgery until 4:30 p.m. and my surgery took an hour and a half, so I was out by oh 6 o'clock. That what I mean? 5:30 is an hour. 6 o'clock. I was out of surgery at 6. When I came to, what time did I come to my room, Ma?
8:20.
I got to my room at 8:20, so I came to at about 8 o'clock maybe. I don't know why, from 6 to 8:30, but I was out, and I woke up in recovery at about 8 o'clock. And my room was ready by the time I woke up. And when I woke up, the pain was not, it wasn't a 10. When I actually woke up from the anesthesia, my pain was about a 7. And they didn't hesitate to give me all the drugs I needed. And I felt so good. Morphine was awesome. Morphine is awesome. I don't have a medicine ball. Like a lot of people have that medicine ball where you just press the button. They said I can only have morphine every 4 hours. And I got some at like 9 o'clock. No, 10 o'clock. I got some at 10. So my nurse said I can have some more at 1. And that stuff put me to sleep, and I was sleeping so good. But, you know, unfortunately, this is the hospital, and I get woke up every 30 minutes. Seems like, something itching. I'm going to show you guys my incision. Also, I'm going to show you guys my drainage tube. I do have a Foley, a catheter. They waited till I was asleep to put that in, so I didn't feel it. It doesn't bother me. I don't feel it. The oxygen was ordered by the doctor, so I have to keep my oxygen because, and I got a feeling on why, because earlier when it was doing my oxygen monitor, it kept saying that my oxygen levels were low. But it's nothing to worry about. He said it's not a big deal. I don't know why I was reading low, so they're making me keep on my oxygen. My surgery, yeah, it took an hour and a half, and I was curious because I was under the impression that surgery only takes up to an hour. So I asked, were there any complications? And he said, no, everything went fine. Everything went as expected. It just took that long. I got to my room at about 8:20, and as soon as I got to my room, I was so ready to get up and so ready to walk. When I first started walking, it was a little uncomfortable, but the more you walk, and I'm sorry, y'all see that? Give me a napkin, Mom, please. My lips are dry. And I do have my lip chapped. I just don't feel like making my mom keep getting up.
What on it?
No. And I'm sorry, you guys. But, they gave me these, things to use in my mouth called, lemon glycerin, what is it called? Lemon glycerin straw. Let me hold it. I'm going to show the whole pack. Put it back in. I don't need it. Lemon glycerin swab straw. Blah, blah, blah. Swab stick, triples. And it comes with 3 in a pack. And this is what it looks like. It's wet. It's supposed to taste like lemon. I don't like them. I don't think they work. It's not wet enough. There's not enough moisture. I'm not allowed to have ice chips. My nurse said she doesn't want to risk anything. So the doctor said I am not even allowed the smallest ice chip. I am allowed to put water in my mouth, but I have to make sure that I spit every amount of the water back out. Hand me my breathing thing. They also gave me this crap right here for my respiratory something to make sure I forgot. Whatever it is, it's supposed to stop any other complications that I might have. And basically what I do is, wait. And they want me to do this every hour that I'm awake, at least 10 times. And I did it, and I don't understand why, but whatever. I still have on a surgical leg band that stopped the blood clotting. I don't know why they didn't hook it back up, but it's supposed to tighten. It tightens up on your leg, and it releases, then it tightens up, and it releases, and it tightens up, and it releases, so that it prevents, because you're laying down so much, it doesn't allow you to clot. My incisions, I only have 5, plus the drain. I'm going to show it to you guys, but it's very hard to see. And I made the last video, but I had a 2-shot of that, so I had to remake the video. But, yeah, it's hard to see because once I started walking, I started bleeding kind of bad. And my nurse said she couldn't clean it because that would cause more bleeding. So she just covered it with gauze and a lot of tape. So I'm going to show you guys what I can, and hopefully you guys can see this. Okay, this top one right here is very little. That's the first one. You can see the blood. This is one of them, and it's just that little right there. That's it. This is the second one, the third one, the fourth one, and that's just the tape. And this is the fifth one. And my drain, I don't want to show you guys no shot. My drain is down here, right here. And I'm not really draining a lot. It wasn't even full earlier, but they dumped it. I do have my IV, and in preparation for surgery, I just got my IV, and I had a hepaderm. I think that's what it's called, and that basically that's a blood thinner that I have to take every 8 hours. The first nurse that gave it to me in the pre-op area, it hurted because she put it behind my arm, and it burned, and it hurted. My nurse now, I love her to death because she stuck me with that needle. I did not even feel it, and it didn't even give that burning sensation that I got earlier. So all in all, I am doing well. I'm doing so good. I didn't really expect to feel this good about the situation. Hold on, you guys. I'm trying to. Mark, can you pin me back up? Just pin it here. Wait, hold on.
Pin it where? Anywhere?
Just pin it. Wait, hold on. I'm going to show you what she had. Just pin it right here. And basically, I'm pinning my, the nursing assistant gave me a safety pin to pin my, drainage because it was just hanging between my legs and whatever. So, whatever. I don't know if I just said it, but I still have on my surgery leggings, which prevent blood clotting. I will show it to you guys, but my pain is coming back a little bit, and it's only 11:30, so I can't have no more morphine until 1 o'clock. They did just give me some other medication for the pain. And whatever it is, she said it's supposed to work better than morphine for the pain. That's some bullshit, and it's a lie. And don't let nobody tell you that lie. Because morphine has been the best thing I could have ever received in this hospital. I'm at the University of Miami, and what can I say about them? Everybody has been more than nice and more than attentive to my every need. Even from when I was in the pre-op area, and I waited for damn near 8 hours, 9 hours to go into surgery, everybody was attentive. They kept coming, changing my blankets. Every time my blanket got cold, they'll snatch those blankets away and go get me some warm blankets. When I came to my room, my nurse came. She took my blankets, threw them away. Well, put them away and brought me some fresh blankets, warm blankets. Even down to my operating room staff, like the lady, the nurse that I had, even though I can't really remember her name, and I only saw her for a bit a little minute before when she came to talk to me. She was so funny, and I felt so comfortable in her hands, as well as my doctor, because I love him to death, my surgeon. And even one of my other nurses, the one who administered my anesthesia, he was the bomb. And it's so funny, you guys, because in the pre-op area, they told me, oh, we're going to give you a sedative. It's not going to put you to sleep, but we're going to sedate you so that you can be relaxed. So once you get in the operating room, you'll just be relaxed. When I say I was just talking to my mom and my sister, or my god sister, I was just talking. And all of a sudden, it just hit me like, whoa, what's going on here? I feel drugged. My mom says that they rolled me out and I was still there. I was still with them. I don't remember being rolled out that room. So when I woke up, it was crazy. And my doctor said I was going to feel like somebody beat me up. And basically that's what it feels like. It doesn't feel like I had a very major surgery. It doesn't feel like somebody cut me open in the inside and stapled me. Even though that's what they did, it does not feel that way. And I can't be more blessed. The Foley is like off the chain because I don't even get the urge to pee, but I see my bag filling up with pee. And I'm sorry that might disgust some people, but hey, it's a part of the surgery. I'm trying to give you guys as much information as possible about what's going on with me. The oxygen, my doctor is requiring that I wear this oxygen because my oxygen levels keep going low. But, whatever, cool. I have an IV in right now for the fluid since I can't eat. They say my catheter is coming out in the morning, and I should be able to shower in the morning. That's going to be interesting because I hope somebody's going to bathe me because the bending down to clean is just not going to work. I can't do it. To bend over is painful. I can't crunch up my stomach yet. My pain right now, on a scale of 1 to 10, and I'm looking over here because my pain scale is over there, and I would say I'm at about a 3-4, maybe a 5, but 3-4 minimum pain. My voice, I thought it was going to be more raspy than this, being that I had the tube. I don't even feel like something was stuck down my throat. So, hey, it is what it is. They gave my mom a roll-out bed to put right next to me. And so, because she's staying here with me tonight. So that's awesome. She doesn't have to sleep in a chair. They made sure she had warm blankets. They even gave her something to eat. So even though they said, make sure you don't give her any, she can't have that. But they are attentive to her needs as well. And I love that. I love the fact that whoever is here with me is getting treated as if they're the patient as well. I have my own room, a private room, and supposedly the floor that I'm on is for bariatric surgery patients post-op. So this is a whole bunch of us. But it doesn't look that way. I think it's a couple of people on here who didn't have that surgery. I'm looking around trying to see what I can show you guys. So yeah, I'm officially post-op and I'm officially on the loser's bench. And I have been out of surgery for 5 hours and 35 minutes. And yeah, it's not that bad. I want to get up and walk because the pain is becoming a little bit, not even the pain, the gas, that feeling you get right here. And it was up here earlier, but it's down here now. It's down here, if you can see. And it just doesn't feel well. The morphine that she gave me did put me to sleep. But, people in and out your room, they got to give you this, they got to give you that. So I'm back up now, but pretty much. So I don't know. I don't know what else to tell you guys. I don't know if I'm going to be able to upload this video. I made 3 videos for you guys. I made one when I was waiting. I made another one when I was in the pre-op area. And this is my 3rd video that I'm making in the hospital. As of yet, I have not had the signal to upload because I'm using my phone. But, hopefully I can upload this for you guys. And, I don't know. I did cry a little bit in the post-op recovery room because I wanted my family to come in, and they kept telling me, no, you can't come yet. You just woke up. I've been out for 2 hours. At the time, I didn't know it was 2 hours, but I've been out for 2 hours. You tell me they can't come, you have to get all your drugs first, and we're going to drug you first, and this and that. And I didn't cry, but I was on the verge. My feelings was hurt. But everything is good. Everything is well. I don't have a morphine ball or a medicine ball. I don't have that. My nurse said that I did a good walk and I don't have to get up again. But I want to get up because I'm ready to go. But all in all, let me see if I can show you guys my room. It's small. So my mom right there in the bed next to me. My window. My chart. My TV and my closet. The clock. The main door. Whatever that is. The bathroom. And all this crap. And back to me. I am sorry, you guys. But when you got a dry mouth, that's what happened. Yeah, so, you guys, I don't know what else to tell you guys. I'm a little tired. I'm about to take it in. And this video might even not upload because it's 17 minutes. So I'm going to holler.